Hi, good day. Sitting for Bina. She's coming now.
Hello?
I didn't shift the camera or anything.
So
This is TTT Live. I'm DK Rasta. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager of Corporate Communications at the Ministry of Health, Candice Alcantara.
Good day. Thank you for joining us for this edition of the Ministry of Health's virtual media conference on the COVID-19 response. Today we have with us the Honorable Terence Dayal Singh, Minister of Health, and Dr. Roshan Parashram, Chief Medical Officer. I'm Candice Alcantara, the Manager of Corporate Communication for the Ministry of Health, and I will moderate this morning's media conference. This afternoon, thank you very much, Minister. We begin with the clinical and epidemiological updates from Dr. Parashram, and he will also give us a reminder of the COVID-19 vaccination process.
Hi, good afternoon. Thanks, Ms. Alcantara. Afternoon to the Honorable Minister, members of the media, members of the viewing and listening public. So I'll go into a brief summary with regards to the clinical update and then into the two presentations thereafter. So in terms of our figures, public and private facilities testing so far, 110,325. Our total new positives from yesterday, 22. And I would just received information from the Trinidad Public Health Lab that in our 4 p.m. bulletin, we will be sending out reported cases over the last 24 hours as a number 46 new cases. Additionally, we will be adding on 3 additional deaths COVID-related for the 4 p.m. bulletin. It will take our total recovered patients will stay, this is now as of 4 p.m., 7,615. Our total positives, 8,026. Total hospital patients have gone up as well, 22 persons in hospital. Number of deaths as of yesterday, 142, will increase today. And those that step down, 6. Total patients in state quarantine, 287. Total persons in home isolation, 219. And just a breakdown of the hospital figures. Those 22 persons, there are 11 persons in the Couva Hospital and Multi-Training Facility, 2 persons in ICU, none in HDU, 6 persons at the Cora facility, and 5 persons at the Scarborough Regional Hospital at Fort King George. So if I could have the first group of slides related to the epidemiological update, please. So we will begin by going through. Next slide. Yeah, so the next slide will give us the epidemiological curve for, as we have seen for quite a while now. So starting all the way on the left, we see the gray parts are the months of 2020. Oh, go back one, please. Yeah, if you could go have the first slide with the epi update. Just back one. Yeah, so just to discuss as they're getting the slide back up. So we're starting with the usual patterns. So if you can go back to the first slide. Right. Looking at the left, we see the curve starting. The gray areas are 2020 again. The green area is January, blue area February, orange area is where we have March. So what we look at is really, if you look at the start of March and we label something, Dr. Hines would have gone through this on Monday gone, PHOC regulation on the 21st of February 2020. That is the regulation, and we have highlighted it on the graph to show where we had created a recent regulation to allow for recreational sports to be played, team and contact sports. And it is highlighted because it's a significant change in the way people were congregating, so large numbers of people coming together to have those activities in close proximity, no social distance, no wearing of masks, no wearing of shields has been observed. And what we noted thereafter, roughly 14 to 21 days, you can begin to see that dotted line which had maintained throughout February and the latter part of January some stagnant level, having 3 to 4 cases per day, and steadily began to rise in the early part of March, 2 weeks after that PHOC was introduced. And that curve has continuously and steadily gone up to the right, and now we're into the 1st of April, and we will see a tall peak added onto that curve from today, which will be 46 cases in the upcoming weeks as we present this graph. What is important to note as well is if you look at the first bit of the orange, if you look at the orange peak and you go all the way to the left where you see the spike starting just before August, you will see that they look very similar, if not exactly the same, and that is a concern. It means that we're beginning to upsurge again, and we want to stop that peak going up, all the way up like we saw in August and September of 2020. Next slide. So this is just disaggregation by age and sex. Again, similar dispositions in terms of age and sex, more or less 50-50. Again, you can see that as you get in the mid-age groups, which is 25 to 59, the bulk of the cases or infectivity has been in that group. 55.1 in the 25 to 49, and in the 50 to 59 age group, 13.6%. Above 60 have accounted for 13.8, and of course less than 25, 17.5. Next slide. Right, so this gives you again distribution and disaggregation of deaths by age and sex. Again, a disproportionate amount of deaths occurring in males, 75.8 versus females, and age again disproportionately increasing as you get older. The rate of death really increased, and we can see less than 50, 15.2%, 50 to 59, 15.8, 60 to 69, 26.2, 70 to 79, 26.2 as well, and 80 plus 16.6. Next slide. Right, so just to give you a little graphical idea of what is happening, the dots really represent different epi weeks. So this is at the end of epi week 11, which would have been week before last. And we're seeing, again, the majority of the cases in the Caroni area. There's a sporadic spread beyond that in St. Patrick and on the border of Victoria as well. And on the top of St. George East, we began to see some clustering of cases occurring there with the purple and the orange dots. Next slide. So in week 12, as you can see, the clustering has increased substantially. Again, maintaining in County Caroni, Victoria, and spreading a little bit further into St. George West, St. George Central, St. George East. For now, St. Andrew, St. David seems to be doing very well in terms of smaller numbers of cases, as well as Nariva Mayaro. to a lesser extent, St. Patrick started to see a small increase over the last couple of days as well. Next slide. So week 12, and this is just a few days after the last one, and you see that St. Patrick has seen quite a big increase in terms of their numbers, and you're seeing some cases in Nariva Mayaro as well, and 1 or 2 in St. Andrew St. David. Some spread occurring in Tobago. If you look at Tobago, you see some cases occurring in Tobago as well. Okay, I think that brings me to the end of the epidemiological part. We go straight into the last bit of my presentation, which is the vaccination deployment, and is really just to outline some key points related to that and some questions we've been having. So last slide, last group of slides. Okay, so the COVID-19 vaccine will be provided to Trinidad and Tobago population, as you know, in phases based on the level of risk and the level of exposure to the disease. The phase 1 rollout of COVID-19 vaccines will continue from the 6th of April, as mentioned before, and begin with healthcare workers, persons aged 60 and over with non-communicable diseases such as hypertension and diabetes. Next slide. So again, persons who are part of the NCD clinics in those 21 designated centers, which are now on our website, will not have to pre-register or make appointments to get the vaccine. They will already be part of the system and will be offered the vaccine if they are eligible when they come to the clinics by the clinicians. Those aged 60 and over will be offered the vaccine when they come for their NCD clinic appointment. Other members of the public who are aged 60 and also have an NCD can call or visit one of the designated sites and make an appointment to have their vaccines at those centers. The contact numbers again are available at www.health.gov.tt/COVID-19. Next slide. These are our designated centers. They have gone through a rigorous process of inspection to ensure that they all can meet the demand of the COVID-19 vaccination and the vaccines. We had looked in terms of the clinical services, whether the crash carts are in place, whether the clinicians are well trained in those facilities as well. So this is the list. So we're going through ERHA, Mayaro District Health Facility, Rio Claro Health Center, Sandy Grande Enhanced Health Center, Toco Health Center, North Central. There are 4 centers as well: Arima, Shogunas, La Joquita, St. Joseph Enhanced Health Center. At Northwest, there are 2 centers: Barataria Health Center and the Diego Martin Health Center. Southwest, there are 8 health centers: Couva District Health Facility, the Health Center at Freeport, La Romaine, Marabella, Point Fortin, Princestown, Siparia, St. Madeleine. And in Tobago, 3 sites: Canaan Bonaccord Health Center, Roxborough, and the Scarborough Health Center. Last slide. So if you are not part of the public sector NCD clinic and you are eligible to get the vaccine, please call the relevant COVID-19 vaccine facilities to make an appointment. The contact numbers are available on the Ministry of Health's COVID-19 webpage and social media: www.health.gov.tt/COVID-19, Facebook, Instagram, Twitter, and YouTube. Thank you, Ms. Alcantara.
Thank you very much, CMO. And we go now to the Honorable Terence Dayal Singh, Minister of Health, for some important updates.
Thank you. Thank you very much, Candice, and good afternoon. Good afternoon to the Chief Medical Officer, ladies and gentlemen of the media, citizens, and all persons listening on the different platforms this afternoon. Ladies and gentlemen, I want to continue where I left off yesterday, alerting the country that this COVID-19 pandemic is not over. We are not in a post-pandemic phase. It is not my intention to go over everything I said yesterday, but just to reiterate the headline in one of Monday's newspaper, where Dr. Carissa Etienne, PAHO warns virus surging dangerously in the region, and that's our region. There are now 129,854,924 cases of COVID in the world. And to date, 2,883,077 persons have in fact died. You would have heard the CMO just say that 3 more of our people, 3 more families in Trinidad and Tobago have in fact been plunged into mourning. And our deepest condolences go out to them. Only those families know what it is like to lose a parent, a grandparent, an uncle or aunt to COVID. When we first started tracking the countries that have racked up over 1 million cases in COVID on October 24th, 2020 last year, that count was 7. There were 7 countries with 1 million cases and over. 5 months later, ladies and gentlemen, the count is now 22. There are now 22 countries around the world with 1 million cases and over. And snapping on the heels of those 22 countries are 2 more with over 900,000. I want to give some perspective of what is happening globally and regionally. Turkey is clocking 40,000 cases per day. 40,000. For those who follow the international news, France has now gone into its 3rd national lockdown. This is not a lockdown restricted to areas of France. This is a total France lockdown, the entire country. And the French president is calling the variants an epidemic within an epidemic. Hospital rates in France are up. ICUs are 100% occupied. And a very disturbing trend in France is that patients are getting younger and younger. Younger and younger. People in their 20s, 30s, and 40s. Schools in France once more are closed again. In France, you cannot travel without good reason more than 6 miles from home. Now, France is a very big country. 6 miles from home is a small distance. And they are calling this the race between vaccination and attempting to control spread. That is France. Germany and Italy are also in some form of lockdown. So continental Europe is locking down again for the 3rd time. In England, you now have fines of up to £10,000 for breaching COVID regulations. In England, you can now be fined £5,000 if you are caught leaving England for no good reason, as they try to manage a 3rd wave. That is what is happening globally. The United States, even though they are vaccinating a lot of persons, they are still seeing a lot of spread. And the CDC director, as I indicated yesterday, is talking about impending doom. Regionally, one just has to look at the news from our CARICOM neighbors to see lockdowns, states of emergency, restrictions, curfews, and so on. I want to make the point again today that when we start the vaccination program next week, and the CMO can bear me out here, the vaccination, as all health personnel around the world are telling their countries, the vaccination is not a silver bullet. It is just one more very important, not one more, but one very important extra layer of protection. I think the CMO could agree with that statement. The reason for saying this is that in Trinidad and Tobago, we seem to have decreased our vigilance. We seem to be thinking that we have beaten the virus. We have not. A disturbing trend which the CMO indicated, that the spread is no longer restricted to maybe 2 or 3 counties, Caroni or Victoria. What you are seeing now is inter-county spread along the east-west corridor where many people in Trinidad and Tobago live. We at the Ministry of Health are very concerned about this recent trend in high numbers which we have not seen since last year. 40s, 20s, 30s per day. And if we extrapolate those numbers into the future without doing something now, the situation is going to become untenable, in that cases are going to mount to hundreds. 3 deaths yesterday is too much. Deaths will increase. More and more families will be plunged into mourning. Our hospitalization numbers will continue to rise again, and all the associated ill effects of an uncontrolled spread of coronavirus will become evident. To short-circuit that eventuality, and as the Honorable Prime Minister said on Saturday, the next prize we want is to have our little children, the senior juniors, those who are attending, who have to write SCA, we want them to go back out to school. And we did say the numbers after Easter will be a determinant of that. In being proactive, after consulting with the Chief Medical Officer, the Minister of National Security, and ultimately the Honorable Prime Minister, who makes the final decisions, the Honorable Prime Minister has authorized me to implement the following measure. With regards to the regulations 3.2, which deals with recreational team sports, be limited to participants of no more than 22 athletes, where such sports are conducted outside of building. As of tomorrow, that freedom we had to participate in recreational sports, both indoors and outdoors, unfortunately we have to roll back. Because what we have noticed is that persons engaging in these sports, and we wanted to do it for people to maintain their physical health and their mental health. But what we have noticed is that it is more than 22 people. The after-game line is becoming dangerous, where food and drink start to come out and people are congregating without mask wearing. So we are going back to how we were. So there will be, for the time being, until further advice, we'll be rolling back the recreational sports for team and contact sports, both indoors and outdoors. This measure will not affect the training or national and international teams. Our national and international teams preparing for their international commitments, whether it's CONCACAF, World Cup, Olympics, whatever other commitments we have to the international sporting bodies, that goes on as usual. What we are rolling back is recreational sports of all types. That is the only measure we are anticipating at this time. All else remains normal. No restrictions on your economic activities. No restrictions on your movement. You are free to come and go. But we are urging caution. We are urging caution. We need to go back to the discipline we had in October, November, December, January, and into the early part of February. As a team, we need to go back to that type of discipline where we adhere to the public health measures. This is especially important as we go into the Easter weekend. We want people to have a safe, holy, and happy Easter. But we are asking persons not to congregate in any type of setting over the Easter weekend. You can go to your beaches, but be careful. Let's not have big lines at home, big lines in public, wear your masks, and so on. So that is a measure we are instituting. The Attorney General has already been briefed, and those regulations will be signed off within the next couple of hours. I want to address one other issue which was raised at the Joint Select Committee yesterday, and that is how Trinidad and Tobago paid for its COVAX vaccines that we received on Tuesday. So we got our first tranche of 33,600 doses. That cost us $148,084.06 US. That money was paid by the IDB under a loan agreement program which the cabinet signed on to in 2016. It is not a grant. IDB did not pay the money. It's a loan. And the government and the people of Trinidad and Tobago will eventually have to repay that loan. So I just wanted to put that on the record. The actual cost of the vaccine per dose is $4.41 US per dose, which includes the actual cost of the vaccine, insurance, shipping, and all other associated costs. So just to put on the record and to further expand on what PS Asif Ali said yesterday, these vaccines are being paid for by the people of Trinidad and Tobago utilizing loan funding. It is not a grant. It's a loan that we took out in 2016. And the final cost is $4.41 US per dose, inclusive of the actual vaccine, insurance, and shipping. So those were the two issues I wanted to address today. One, to announce the new measure as authorized by the Honorable Prime Minister, and to give the country an update on how the vaccines were paid for via loan funding via the EDB. Candice, thank you very much.
Thank you very much, Minister. And we move now into the question and answer segment. We, of course, invite our media representatives. Please indicate your name and the media house that you represent before posing no more than 2 questions. In the interest of time, please make your questions concise and please ask both questions at the same time. We will come back to you if time allows. We begin with questions from Guardian Media Limited.
Rashad Khan, Guardian Media Limited. Okay, so both my questions are to the Minister of Health. My first question is, I just want to get some more clarification as to why we decided to use this IADB loan, especially considering that on October 9th, you revealed that the Cabinet had approved around 66.1 million TT dollars to be used for the procurement of vaccines. And with this amount of funding being allocated by Cabinet, why is it that we chose to, utilize that loan from IADB, as well as the Ministry of Health has reportedly reached out to private sector entities for funding for some vaccines? And now my second question is, these numbers which you all have put up for persons to call and make appointments for vaccinations, when does that become active? Because I've been getting reports, numerous people have messaged me and say that these lines aren't being answered when they call. And is it a case that they will be manned throughout the holiday period, this upcoming holiday period, to take appointments from the public?
Thank you. So Rashad, we never accepted nor asked for funding from the private sector. I think we have said that several times. The IDB loan was approved by Cabinet back in 2016 to use for purposes like this. As a matter of fact, we would have gone to Cabinet under the Ministry of Planning and Development to repurpose a part of the loan to do that. So this was done all under Cabinet approval. It was a quick way of getting the money to COVAX. So if we had not paid in a particular time frame, the shipment of vaccines would have been delayed. On the issue of the phone lines, yes, we know that the phone lines are busy. Not all of the health centers will be activated over the holiday period, but we do ask people, remember these are for local communities, you can go to your health center in person and make your appointment to start vaccinating from Tuesday. But what we are encouraged by is how many people actually want the vaccine. We know the phone lines are busy. Bear with us as we get through this initial period. But you can actually go into your health center in your community and make your appointment physically and in person.
Thank you very much. Now questions from 98.1. Okay, we seem to have a little technical issue. Are we going to 98.1 at this time? Okay, so we'll move to the next and come back. We'll go to IETV then, please.
Hi, good afternoon, everyone. I have one simple question, one short question. I don't know if Minister will take this for the CMO. So from the 1,000 shots we are expecting to give out per day, are there any plans to increase this figure based on vaccine access and security? Because doing the math, it will take about 24 to 27 months to achieve herd immunity. And do we have that time? Thank you.
Okay, so as we said yesterday, we are targeting 1,000 shots in the first instance, and we hope to ramp up. We have a series of plans for phase 2 and phase 3. So let us repeat again. In phase 1, where we only have at this point in time 33,000 doses, we are targeting for phase 1 essential frontline healthcare workers and those people with NCDs in our clinic. We are targeting that. We have plans for phase 2 and phase 3 for more sites, mass vaccination sites. At that time, after we get, as I said yesterday, after we get enough of a body of knowledge of how we are responding to the vaccine, we are not seeing major side effects, then we ramp up more and more and more. So while I appreciate your concern, let me say we have taken it into account, and it will not take 27 months to get to herd immunity. We are going slowly at the start, and we will gather pace. Okay? Thank you.
Thank you very much. And we go to AZP News, please.
Hi, good afternoon. Prabhi Hari, AZPnews.com. I just wanted to find out, when I asked this question, I think earlier this week with Dr. Hines about the contact sports and whether there was whether the contact tracing was done to show that the absurd was a result of the opening up now of these contact sports. There wasn't any evidence like that. I don't know if it has changed, because before, I think the contact tracing of the new cases showed that it was done. It was a result of people gathering at bars and religious gatherings like that. So I just want to know, has the evidence now changed to show that the new cases are a result of the opening up of contact sports? And secondly, the option, I know the minister has spoken about an online option where people could go and sign up, but I'm not seeing it on the Ministry of Health site. So I don't know if there is any clarification that can be done here.
So I will take the second question quickly, and then the CMO will take the first one. The online option will be launched within the next week for the latest, absolute latest. We're just working on some final details with it.
Right. So I believe what Dr. Hines would have alluded to was when we had the cluster in Caroni, and Dr. St. Bernard would have been on even the Saturday before and indicated that 2 or 3 persons had direct contact with bars at that point in time, and there was a group of people in one cluster that was being tracked related to a church. That's what I think they were referring to, just giving examples of the type of contact that they would have noted in Caroni in a particular instance of clusters. When you look at the temporal relationship with our regulation and what is happening during the gatherings, so you have large numbers of people, sometimes 100, sometimes 200 and more people in the savannas, not wearing any face masks, not wearing any face shields, in very close proximity. That has been shown to be the nidus of spread in Trinidad and Tobago, historically and going forward, and in other parts of the world. Once you gather in large numbers and you don't adhere to the public health guidelines, meaning having your distance apart or not wearing your face covering, you have a very, very great risk of spreading the virus from one person to the next. We anticipated that it would have started quicker in Caroni and Victoria, because they would have started with a higher base in terms of their viral load, and what started with a few cases in St. George East and Central quickly ran up and is beginning to go upwards, just like we saw in Caroni and other parts of the country. And remembering that Dr. Hines and myself had made the point that yes, we disaggregate by county just to show where cases are, but we are one country. We can easily go from one place to the next in a few hours, and we take the virus with us. So the county maps are important, yes, but it gives us we have to look at the country as a whole. We look at Tobago as people begin to move, and Dr. Hoyt would have been on saying that the occupancy levels in Tobago over the Easter weekend are very, very high. We expect that a lot of that movement is occurring from here at Trinidad to Tobago, and we want people to be extra vigilant. Anytime you congregate without a mask, you find that you put yourself and you put those other persons at risk. Remembering that this is an invisible virus, it requires persons can spread it without symptoms as well as asymptomatic. So we have to, recognizing the increase in numbers in country, the viral load across the board is higher, therefore the likelihood of spread is much greater at this point in time, and we need to look at our behaviors and have personal responsibility across the board exercise, especially over this weekend and going forward.
Thank you, CMO. We go now to Newsday newspaper, please.
Good morning, everyone. Rihanna McKenzie from Newsday here.
Good afternoon, Ms. McKenzie. You have some additional sounds coming from your speaker, from your microphone. If you could ask persons to just reduce their volume level. Thank you very much. And good afternoon, Ms. McKenzie. Have we lost Ms. McKenzie? Okay, so we will go to TV6, please. Let's go to TV6 and come back to Ms. McKenzie.
Good afternoon, everyone. Urvashi from TV6. I think I'd like to ask the CMO if these, I think you call it sequencing, was sequencing done to determine if we have other variants of the SARS-CoV-2 virus in circulation? We've seen that the Brazil P1 strain has reached Paraguay, Peru, Uruguay, and also reports that it has also reached Venezuela. And we also know that police continue to detain persons for illegally crossing into Trinidad and Tobago. So that's my first question. My second question is, Minister, we received this COVAX, the 33,000 COVAX vaccines on Monday, but of course, the administering of the vaccines will start on Tuesday. That's more than a week, and I'm asking, why was this vaccine administration process stalled given the expiration dates and so on? We saw other Caribbean islands, they would have gotten it one day and then just started administering it maybe at max 2 or 3 days later. And also this registration online, it couldn't have pre-registration been done in advance? Thank you.
Okay, so Urvashi, the vaccination plan was not stalled. If you recall, I have always been consistent saying that once the vaccines have arrived, we will start the rollout within 3 to 5 working days. I have been very consistent saying that. So we got it on Tuesday evening, Tuesday night. 3 to 5 working days will actually take you into Tuesday. What we had to do was receive the vaccines, certify the cold chain, package them out into the 21 sites, send the shipment to Tobago. Today, I believe it is going to Tobago. It just reached Tobago, and therefore we have public holidays tomorrow. It's a long weekend, so we are targeting the first working day available, Tuesday, so it was never stalled. We have always said 3 to 5 working days afterwards. Then you ask about pre-bookings. Yes, so all the NCD patients in the clinics have pre-bookings, because when they come in for their clinic days, as we have been saying, that is your booking. So your regular clinic date, you are pre-booked to receive your vaccine. It is the members of the public who are coming in on the non-clinic days have to make their separate booking now. We could not have done that before because we only got the vaccines on Tuesday that we were sure of, and we are sure that we are going to start on Tuesday. So let me reiterate, nothing was stalled. It was always carded 3 to 5 days after receiving, 3 to 5 working days. Thank you very much.
Yeah, so I think your statement that you made about the variant and the possibility of a variant existing is correct, in the sense that there's always a chance that we can have the variant come into the shores. So we look at, of course, our quarantine orders are in place through the repatriation efforts, which will minimize the amount of variants that we have coming in. And of course, because we have quarantine, we will be able to pick them up with our testing regime as we continue to test all positive repatriates, have them sequenced. We started a couple of weeks ago when we had the increase in Caroni and Victoria to actually do some sequencing of the local cases just to make sure that none of those persons were picking up the variant as well, because we see really and truly there's a quicker rate of spread than we would have anticipated at this point in time. So we have sent those across to the UE lab via CARPHA for sampling. So far, none have come back as variants of concern from that group. We will continue to sample as quickly as we can and send them across for sampling. If we do get a variant of concern, we will alert the public as we have done before.
Let me just correct a bit of misinformation that was making the rounds yesterday with one or two media practitioners who contacted me to say that CARPHA had stopped testing for variants. You may remember both myself and Professor Carrington explained to the public how the variant testing is done. The samples are collected, they are sent to CARPHA for coordination and onward transmission to the University of the West Indies. CARPHA does not do the genomic sequencing. So there was this thing yesterday that CARPHA had stopped the genomic sequencing. That is absolutely incorrect for two reasons. CARPHA just collects the samples from all the Caribbean countries and sends them to UE, and UE does the genomic sequencing. So it has not stopped, at least for Trinidad and Tobago.
Thank you very much. And we will go to Guardian Media Limited for a follow-up question, please.
All right, thank you again. Minister, is it possible that I could get a little bit more explanation on to the rationale that you would have described there of it being quicker to get the IADB, access to the IADB funds to pay for the vaccines, and when it is that we expect that we will pay back that money from that loan?
Okay. So I would remember prior asking this question some months ago, whether we are in talks with IDB and so on for COVAX fund, and I said yes. We have three streams of financing as approved by the cabinet, one through IDB, which I said a couple months ago, one through the World Bank, and the other through the Ministry of Finance. We have this existing IDB loan called the HSSP loan, Health Sector Support Program loan, signed off on in 2016. So we made the payment, and then what will happen, I have it here, the government made the payment to COVAX, and then IDB will send the money back to us as part of the loan arrangement. It was quicker to get it done this way because we had to pay the money as soon as possible into the central bank, which I spoke about maybe about a month ago, because you have a particular window to commit to paying COVAX. So that is what we did. We also have loan arrangements with the World Bank for the procurement of vaccines. So you have IDB, you have World Bank as loan facilities. Okay?
Thank you very much. And now we will go back to Newsday. I think we have solved the issue there. Going back to Ms. Mackenzie.
Hi, good afternoon, everyone. I apologize for earlier. I hope you're hearing me better now.
Yes, we are. Thank you.
Okay, good. All right, so my first question, can you indicate how many cases are linked to the recreational sports that you said has caused the problem? My second question, of course, you've indicated that in the first phase, healthcare workers and people over 60 with NCDs will be receiving vaccine, but do you have an idea of how many people in each of these categories will be getting vaccine, or is that dependent solely on registration?
No. So you deal with the number of cases, I will deal with them, yeah.
Right, so what we showed in the first graph that I put up, which is the epi curve, is there's a temporal, epidemiological and temporal relationship between the lifting of that or the opening up of team sports, contact sports. Inherently, what we know about COVID-19 by the way it spread through droplets and through close contact, all things being equal, it seems to be a driver of the spike that we are seeing at this point in time. And Minister would have alluded to other factors in terms of complacency generally. It is not one thing in the population that is causing the increase in number of cases. It may be multifactorial in nature, but to the large part, it seems to be a breakdown in the adherence to the public health guidelines, which we all need to go back, as he said, to a few months ago and really have those regulations at the back of our minds. The mask wearing is especially important. Once we take off our masks, we noted when we introduced mask wearing at the end of August, we saw a precipitous drop beginning in September when we had our major wave in August and September, all the way down to February. The mask wearing is one of the most positive public health measures that we have put in place. It is a mandatory public health measure that is enforced by the law, and it has really helped Trinidad and Tobago be in the place that we need to be at this point in time. The team sports and the contact sports, what we noticed is that persons weren't wearing your mask or your shield and congregating in extremely large numbers in small spaces, sometimes small gatherings for significant lengths of time, more than 15 minutes, which is what WHO defines the potential of spread in terms of a primary contact. So it is not one factor that lends itself to it, but it certainly seems like it is one of the major drivers that we have pushing ahead this particular spike.
Thank you. And I will answer your question about the, I think it's the number of persons we are targeting in the healthcare system. So total, the first phase, yeah. Total number of frontline persons we are targeting in the first phase is 6,621, right? So there are roughly about 17,000 persons in the public healthcare system. So this is roughly 30% of them who we have deemed to be frontline across 11 categories of healthcare workers, right? So 6,621 out of around 16 to 17,000 across 11 categories of healthcare workers. And you wanted some idea of the NCDs, right? The NCDs, we are targeting, started targeting the first phase because the number of vaccines we have can't do all the NCDs. That will come when we get the other 77,000. NCD patients, we are targeting, starting to target 40,950. Okay? So that is what we are targeting. Obviously, the 33,000 would not cover all, but we can make a serious dent in that. And when we get the other shipments, as Dr. Wheeler said yesterday, into May, we could start to finish off that first group and hopefully be finished with phase 1. Okay, thank you.
Thank you very much. And we go to to AZP News at this point for a follow-up question, please.
Hi, good afternoon again. Minister, the Prime Minister of Jamaica says within the next 5 years they would get 75 doses of AstraZeneca from the African Medical Support Platform. What is our status with regards to the vaccines from that platform?
Well, I hope it's more than 75. I hope you mean 75,000. Okay, good. All right. Yeah. So we are still working with African Medicines Council. We have no firm commitment yet. We have not gotten price estimates or ETAs as yet, but we continue to push. Okay?
Thank you very much. And we go to TV6, please.
Good afternoon again. Thanks for the opportunity. I was hoping that the CMO could explain a little more as it relates to the vaccination plan, particularly CMO with respect to how are we going to vaccinate as many persons as quickly as possible to remain within the deadline with respect to the expiration date for the vaccine. From the first set that we would have got from Barbados, there would have been roughly 1,000 left. From that, to do the second dose, could we not have administered these as a first dose to 1,000 patients, given that we already got that 33,000 from COVAX of the same AstraZeneca on Monday? So could you just explain the plan going forward so as not to allow these vaccines to expire in our hands? Thank you.
All right. So yesterday I would have explained it at the Joint Select, but basically what it is for this particular batch of vaccines, 33,600, the expiry date is the 31st of May 2021. We begin our vaccination strategy on the 6th of April, our second set. That will give us, in best case scenario, for the first person that is vaccinated, approximately 7 weeks if we are using that batch to give you 2 doses. All right. WHO has put out guidelines that said that our second dose should come anywhere between 8 and 12 weeks to give us the best chance of efficacy. The manufacturers had stated earlier on in the year that they were using 21 to 28 days. Basically, if you look at the difference in efficacy, 76% after you get your first dose. After you get your second dose, if it is anywhere between 21 to 28 days, it gives you the lower part of the 80s. And when you have your second dose, somewhere between 8 and 12 weeks, it goes up into the 90s in terms of percent. So the best place to have your vaccine is between 8 and 12 weeks. They are now saying closer to 12 weeks is better. What we will do is we'll give half of the doses. So we'll reach to 16,000, just above 16,000. At that point, we will make a decision based on the incoming supply of AstraZeneca, which we are expecting. Once we can confirm either it has already landed or is to come in the near future, then we can make that decision to go ahead, use the 33,000 for our first dose. If that is not coming by the time we get to that stage, we can use the alternate pathway, which is giving the second dose with the existing cohort, and going at 7 weeks or 6 weeks for the second dose. So that decision will be made only when we get to 16,000 doses, and we will have more information hopefully at that point to make an informed decision based on the ETA for the incoming tranches.
Thank you very much, CMO. And I see AZP News has another follow-up question.
Yes, good afternoon again. I just wanted to find out, at what point did we realize that these vaccines, had a short expiry date? In other words, when they were ordered and when they were coming, should we have not known that before, and maybe we could not have accepted it, and waited for one that had a longer expiry?
Okay, so generally when we deal with COVID-19 vaccines, what has been the experience worldwide is that the vaccines have a shorter expiry than the average vaccine. For example, a yellow fever vaccine will come with 18 months on it or 2 years. This particular vaccine is giving us 6 months, and the rationale for it really is that the vaccines have not been authorized for a very long period of time. So the manufacturers are hesitant to put long shelf lives because they really didn't manufacture it such a long time ago that they could actually test it to see if it remains viable. So that will happen in the coming months. But for now, they're using 6 months from the date of manufacture. So what we get is from the COVAX facility. It is manufactured. They actually do the acquisition of the vaccines, and through the PAHO system, we get the vaccines. We would have first had an indication of the expiry date on an invoice when we got the invoice. However, that was not confirmed until the date of arrival, when the package was opened to check 2 things, to check the temperature as well as to check the expiry dates, and which that was confirmed on the night that it arrived a few hours later, which I shared with the media the next morning, I believe.
Thank you very much, CMO. TV6, I see one more follow-up question. We'll slip it in.
Thank you. Minister, given that we're also expecting donations from China and India, sizable donations, how much consideration would be given to looking into the expiry date at this point to ensure that we're not stuck in another jam later on?
Okay. So, Urvashi, things in the world of vaccines, we have to realize we are in the middle of a global pandemic, and supply of vaccines is trying to catch up with demand. This is not a situation, Urvashi, that is unique to Trinidad and Tobago. All countries around the world are faced with the same problem. This is not unique to us, right? Previous question, why didn't we wait for vaccine with a longer expiry date? If I had done that, you would have been the first person to ask me why I didn't take the vaccines expiring in May so we could start to vaccinate people. So it's a case of damned if you do, damned if you do, damned if you don't. 2 months is not a bad place to be in now. It's not ideal, but nothing is ideal right now in the world. We will make all efforts to get vaccines that have good expiry dates, but all is not normal in the world of vaccine manufacture. Just this morning it came out that a plant that is making one of the vaccines in the United States had to dump a whole batch because of contamination. Now, if we were waiting on that, what would have been our problem, theoretically? They had to dump millions of doses. Things are not normal right now. This issue of the expiry dates is not unique to Trinidad and Tobago. It is a regional issue. It is a global issue, right? And we have to do the best that we can in bringing WHO safe, approved vaccines for our people in Trinidad and Tobago. But we will do our best to get vaccines with longer expiry dates. Thank you.
Thank you very much. We have come to the end of this afternoon's media conference. Thank you everyone for taking the time to participate today. We were reminded that COVID-19 is still with us, and unfortunately the numbers of cases are rising. We were asked and implored everyone, please remain vigilant. Please continue to follow the guidelines. But we have received the first shipment of a significant number of vaccines, and we will continue the national vaccination program with those at the highest risk and highest exposure to the virus, our healthcare workers, and our adults 60 and over with NCDs. And this is the beginning of our phase 1 activity. We ask persons who are in NCD clinics in these 21 designated facilities, you will be offered the vaccine when you come to your clinic appointment. We encourage you to take the vaccine. Those of you who are 60 and over and have an NCD, you are invited to call the 21 locations, any location that's closest to you, to make an appointment. We begin the next stage of our vaccination on Tuesday, the 6th of April 2021. And just a note please that the facilities will accept your calls for vaccination during standard working hours, Monday to Friday, non-holidays. We thank you very much. Everyone, please remember just 3 W's: watch your distance from others, wash your hands, and of course, wear your mask.